So my name's Alec, I'm 25 years old. I had my transplant in 2013, so I would have been 14 years old at the time. Currently now I'm working at the RCH, which has come full circle.
I'm Annalise, I'm 17 years old. I had a kidney transplant 15 years ago, and I've been living with kidney disease ever since.
Growing up as a teenager is hard enough in itself, but adding kidney disease on top of that just makes things a little bit 10 times harder, I'd say. So I think the hardest thing about that is keeping up with the social perspective of things.
Some of the hardest things that I've dealt with dealing with the kidney disease as a young adult is I've definitely missed out on a lot of opportunities, whether that's in school, outside of school. I remember as a kid I always wanted to follow my brother's footsteps and play footy like he did. Unfortunately, I wasn't able to just because of the risk of damaging my kidney.
I think one of the main things that's different for me living as a young person with kidney disease rather than some people around me, like my friends, is that I can't do some things because I get fatigued. That's the main thing that I find. And also I find that I'm having to always, do little things like seek shade and drink more water than my friends and that kind of thing. But the fatigue is the main thing that I find is different.
I'm treated slightly differently towards, teachers treat me slightly differently as they see me sort of as a different type of person, or one that they have to be more fragile with.
And I'm going into VCE now, but there have been some situations where I've missed, classes that are kind of valuable to me due to hospital appointments.
As a young person living with a chronic disease, I definitely have highs and lows, and especially I find around my birthday for some reason when I wake up and have my medication, it's just like, oh, okay, you have a chronic disease. And I cry a lot on my birthday actually because it's just a reminder of how sick I am and that I'm not a normal 23-year-old. I just go to my doctors and I just explain how I'm feeling, and my GP, she's fantastic if I can't get in to see my kidney team, and she consults with them, and yeah, so it's just really good. I have a lot of support around me, and I find that my renal doctors at my adult hospital are very good with dealing with mental health issues as well as kidney things.
I think at the moment that uncertainty of that expiry date of a kidney or expiry date of a transplant, I think that's a big thing that can be worrying on anyone's mind that's had a transplant. I think at the moment I'm just banking on I'm taking my medications on time, I'm looking after myself and making sure that I'm looking after everything in my body to make sure that I'm not jeopardizing anything in the future.
The biggest worry that I have living with kidney disease is when my next transplant will be, because I had my transplant when I was 14 years old, so I know that I'll definitely have to have another one in my lifetime, but I don't know when that will be, so that's probably the biggest worry.
So a lot of young people do worry about where they're going medically. Me personally, I'm very on and off about it, Sometimes I do worry when new things sprout up. Like I said, I'm learning things every day, but usually not really. I'm kind of just chilling and whatever happens, happens. Positive aspects of what I've gone through and what I've been through are definitely gaining a lot more resilience, and I've gained a lot more confidence in expressing myself. I feel like the experience that I've had is an experience that a lot of people don't usually experience. So I feel like since I've had a lot of hardships, since I've had a lot of, falls, it's helped me get back up stronger than ever. So in a few years' time I'll be seeing an adult kidney doctor, and I'm definitely excited since it's a whole new experience, and I'll get to have a lot of control over myself, and I'll be getting support directly towards me.
The prospects of transition and then going to see an adult kidney doctor, I hated. I was scared, I was nervous, and I was obviously at that point very independent with my care as well. It wasn't that I was relying on parents for anything, but I was still scared. I didn't want to leave the hospital.
A lot of kids my age will, they're very scared or worried about how the transition is going to go, whether, what if they miss out on appointments, will that be rescheduled for them? And then, they're scared to mess up medications as well.
Obviously, coming from a hospital like this, going to an adult hospital that looks dreary, grey, very dark kind of thing, was not a favourable kind of experience.
I'm pretty chill about seeing like an adult kidney doctor because I've had like such a great transition team, and I've met all the people that will be involved in my transition into the hospital. Like, it's not scary for me anymore. I just go with it, and I know that I'll have my parents with me as well for the first couple of appointments.
The first time that I had an appointment at an adult hospital and saw a kidney doctor, it was very scary because he came out in a suit and tie, and he was very much, this is your diagnosis, this is what we're going to do, and now you can leave. And I remember thinking, oh, that was very intense. Like, he didn't really want to know about me or anything extra. He just wanted to know my disease and how I came to having a kidney transplant. But once I kept going a couple more times and saw a couple of different doctors, I realised that that's just who they are in adult hospitals, and that they will get to know you, but just those first couple appointments, they want to know the disease and the outcome.
The difference, I would say, would be with seeing a adult physician versus a pediatric physician, I think, was that I got treated like I was my own person. I think the biggest things were that you were walking into a room with just one doctor and they were asking you as if you're an adult, how are you feeling, what's going on. The transition service helped me significantly in the sense that they, as I said before, broke the ice. They helped to kind of alleviate the fears of that uncertainty. I think going to an adult hospital comes with its own kind of challenges and barriers where you don't know what to expect, whereas the transition team helped quite significantly in just telling me exactly what to expect, and kind of don't be afraid to ask questions, I think.
I started having appointments here at the transition clinic, which was amazing, and the people there, they got me on apps to help me manage my medication, and they gave me certain things that I could do on my phone, which is great because I'm a Gen Z and I'm on my phone a lot.
I'm learning to take medications into my own hands, and even though I still have my parents check my medications on a regular basis to make sure that they're all correct, I'm now using alarms and stuff to remind myself, as well as making appointments for different clinics if I need to. And now I'll be going into hospital myself, by myself occasionally, so that I get more independence with that.
That was the time where I started to go to appointments by myself with the transition clinic. They said to Mum, you need to wait outside, and that was really good for me. I think I didn't have to think about my mum chipping in, and I could just say how I felt, which was really good.
Making or rebooking appointments can be scary because you don't know necessarily, or I didn't know necessarily what time it needed to be booked, what day it needed to be booked. I just sort of went off my calendar, but if I was to go with my parents, then what would their calendar say? Would they be able to take me, or would I have to take public transport? And just talking to adults over the phone can be a little bit scary as well.
Outside of my kidney journey, for me, I think I'm excited about just trying to kind of upskill and work towards building a better career. I think currently I'm a registered nurse. I think working towards becoming trained in other specialties.
I think that the thing that excites me most about the future is moving out. As I'm 23 now, and I'm kind of sick of my parents nagging me all the time to do kidney stuff and take my meds and things like that.
The best piece of advice I'd give to a young person approaching transition is ask questions if you have any, and don't be afraid to talk to doctors or nurses, and if you're concerned about anything, just talk to them.
Some advice that I would give of a young person who just got a chronic disease: get all the support you can get, because There are a lot of support groups, there are a lot of people in your life that can help you, whether that's family, whether that's friends, whether that's your doctors. There's a lot of support that you can get, and I feel like you should take advantage of all of it because it can be a very stressful time, and getting that support is very important, and it can help you develop as a patient and as a person.
I think the best advice I could give to a young person that's transitioning to adult hospital is that it's going to be okay, and that even though you think that it might be scary and that adult hospitals can be a little bit confusing, it's going to be okay, and you'll be okay at that hospital.